Okay. Well, hello, everyone. I want to thank you all for taking the time out of your busy schedules to join us today. And I'd like to thank you also to Janelle and Tabby for inviting me to share with all of you. I feel really honored and blessed to be in this really rewarding profession. I'm a speech-language pathologist in a center program here in Michigan, and we service preschool students, actually early intervention, through high school students. I've been in this field for 19 years, going on 19 years, which seems like a blink of an eye at some times. So I've seen a lot of different experiences and met a lot of wonderful families along the way. And I'm hoping that everyone listening today will find some great takeaways that will help guide you as either the professional working with a deaf or hard of hearing student or as the parent of a deaf and hard of hearing child. So I know I'm going to kind of tailor my presentation today to more of the parent end of it, so I apologize for those professionals that are listening. Some of this might be maybe old information or a review, and it's always good to hear that again. I also, before I want to get started, want to also thank Janelle and Tabby for all of their hard work in Michigan Hands and Voices, in Ohio Hands and Voices. It's a terrific organization, and you do so much for our families, and it's wonderful to have that support. So keep doing what you're doing, and we love you for it. So this is wonderful. So as we start, let me start by saying that students and families that we service are each really very unique. They each have individual needs, and they come from different backgrounds. They have different communication mode preferences. Some might be auditory oral, some might be sign only. Some might be a combination, which we call total communication, of sign and speech together. They have varying degrees of involvement with their children and are at very different places along their journey. So with that being said, as we start to talk about assessments and evaluations today, we need to keep this in the forefront of our minds when planning for IEPs and three-year evaluations. Those are all important factors to consider. So let's start with defining what is an assessment. So an assessment is more formative in nature, and I'll get more involved and explain that a little bit in our further slides as we move forward. It helps to identify strengths and weaknesses of the student. It's an ongoing process, so something that you can continuously do to really monitor the progress of your student. It helps the team identify areas that need improving and help guide instruction. And it helps to track student progress as well. So you're looking at IEP goals. You might be able to do periodic assessments along the way to really assess if they're making the progress that you would like to see. And criteria is flexible and can change. So it's not real rigid as far as directions that might be given on the assessment. It could be teacher-led or designed. So it's real flexible, and you can gather a lot of information that way. So now let's look at what an evaluation is. More summative in nature, so it's a little different than formative, has set standards that are imposed to allow for consistency in presentation. So you're looking at more formalized testing here that will give you standardized scores in comparisons to a specific group that you're looking at. Allows you to determine a student's skills at any given moment in time. And the criteria is really fixed within the evaluation. There's not a lot of flexibility. When you give a standardized test, there's rigid rules that you need to follow as far as administration. So it's a little different as far as flexibility. Now let's take a closer look at the difference between formative versus summative assessment. So they both provide students and teachers the information they need to improve the learning process while it is happening. And it can happen multiple times across a unit of study. And this allows the teacher to adjust changes to his or her teaching quickly and help guide instruction. For example, if a teacher is giving a lesson in math, for example, they might teach the lesson on Monday and the students come back on Tuesday. They might give them a quick quiz to see how well they're learning the information and retaining the information. And if so, they can obviously move forward in instruction, or if not, they might revisit that lesson, a little more support and more practice with that. So this allows the teacher to implement changes in their teaching strategies immediately. also allows for IEP goals to be adjusted if necessary along the way. So new goals could be added if appropriate, if they're progressing along nicely, maybe achieve those goals prior to an IEP, or if the student is not making progress as the team had hoped, you can adjust those goals as well. So now we have a better understanding of formative assessment. Let's take a look at some examples. It could be student-teacher conferences, completing a quiz, like I mentioned before, on any topic. Student completes a graphic organizer on a designated topic of study that we can really assess what the student is gaining from the information and gathering. And the student may write a summary on a lesson or a topic. So let's talk about summative assessments. These are typically given at the end of a unit and are used to measure mastery of targeted skills. They are product-oriented and often have externally imposed standards. They're usually also broader in scope and measure learning over a longer period of time. So a few examples of summative assessments might be final exams, where you're really looking across a whole unit or semester of the learning, state exams, district exams, end of unit chapter tests, or a final paper or project. It's a real cumulative assessment of their learning along the way. So now that we've defined formative and summative, let's look at formal and informal testing. And as a professional and a member of an evaluation team here in the schools, it's important to really take a look at what kind of testing information is needed. We need to keep in mind that testing takes away time from the student's academic class time. So as professionals, we want to respect the student's precious learning time and have a clear end goal in mind. We don't want to test just to test. So again, as a team member, we want to ask ourselves, what is it that we want to know, and what is it that will best benefit our student? We want to make that time really important and critical. This is where the determination can be made between formal and informal testing, or perhaps as a team you determine both will be necessary for information, and you can use both forms. So formal assessments include measures that provide standardized procedures and statistically based systems for comparison. So that means you're looking at very specific directions for the child. They have to follow a specific protocol. There's not a lot of wiggle room or flexibility that way. So standardized tests are assessments that are administered in the same manner to all test takers with the same grading system. So the child's compared to his or her same age peers. You can also get percentile rankings as well as grade level equivalents for standardized scores. And when, as a parent, when you receive those scores, you're looking at the range, an average range between 85 and a 115 for scoring. And the standard score of 100 is considered to be the mean when you look at standard scores. So I know in the realm of special education there's a lot of acronyms, and same as the world of testing, there's a lot of acronyms as well, and a lot of terms that might not be real familiar. So you want to make sure that you ask those questions of your team members that are working with you to really make sure that you understand what those scores really inform you and what kind of information they give. So informal assessments can be systematic observation of data. So you can observe the student within the classroom or within a small group setting. You can also have parent or teacher interviews. There are surveys that you can give to the parent. Do they act differently or perform differently at home versus school environment? And how do they do in different classroom settings, such as specials or a mainstream classroom or a self-contained room? And what kind of peer group do they interact well with, or size of peer group would also be important information to know. You can look at data collected from student work. You can also look at student portfolios. So why are informal assessments helpful? So specifically for the deaf and hard of hearing population, informal testing is really helpful due to the difficulties with formalized testing and the lack of traditional formal testing. specifically for DHH students. So they also help determine modifications if necessary, and they can help guide goals when you're writing IEPs or individual education plans for your student. I'm sorry. What cues does the student need? So when you're looking at assessing, you really want to be able to look at what kind of level of cueing system that the student might benefit from. So is the student at an independent level? Do they need verbal prompts, such as auditory cues or repetition? Do they need acoustic highlighting or rephrasing of directions? Do they need visual cues or picture supports, gestures or visual phonics cues or written models to really help them? So with informal testing, you can do real-time observations to see where the student is most successful and where they might begin to have difficulty with a particular skill. And this, again, this information can then be added into short-term goals on the IEP for scaffolding support. For example, if I'm looking at and really working with a teacher to assess a student's writing skills, I might look at what is the student already doing independently. Do they need adult models? Do they need support at the sentence level? Do they have noun-verb agreement in their writing? Are they using punctuation independently? Do they need a writing prompt? Do they need picture supports to help them even get writing? So at what level does the student need support? And you can easily tie those into your IEP goals as well. So you're kind of looking at the most to least structure. So far we've defined various testing terms. So now let's discuss why, as practitioners, we assess and evaluate our students. So we looking at baseline information or baseline performance, which is a nice way to gather information in the very beginning, and you can see then and track your students' progress along the way. You can determine an appropriate placement or change in placement. If you're looking at different programming for your student, this is a nice way to piece all that information together and make an eligible decision, educated decision. You can determine eligibility. So maybe the student is just entering special education. You can gather that information that way. Or changing eligibility. Maybe hearing impairment is not the priority impairment at this point. Maybe there's another disability that might need additional services at that time for the student. Measure a student's progress. That could be ongoing. And suggest solutions to identify problems such as behavior, attention, or slow progress. So now that we've determined reasons why we test, as I stated earlier, testing is time-consuming for our students. So there are not a lot of DHH-specific tools that are available, and the English demands within the test are difficult for our DHH students to complete. So one might ask, are there benefits of testing this population? And yes, there are benefits to testing. And that would look at helping the teachers guide instruction. Again, you can glean a lot of information from your assessments and evaluations that help teachers change their direction of instruction, add more support along the way. You can look at identifying a student's strengths or weaknesses and progress, and help to develop long and short-term goals for your student's IEP or individual education plan. So here are some more benefits. You want to maybe validate the concerns of parents and teachers about their child's performance or progress. Help to identify areas of strengths and weaknesses, so for further diagnostic teaching or observation that might be necessary. So the unique needs of our students require a team of knowledgeable professionals that work together for the success of the student, and this is so important. So as professionals and parents, we need to ask this very important question. Are we on a team, or are we on an island? And I know at times it feels like we're on an island, but you really want to work together with your team to gather all this information to best support your child or student. So here in Michigan, our evaluation team is called the Multidisciplinary Evaluation Team, or MET, M-E-T. In Ohio, your evaluation team is called the Multi-Factored Evaluation, or MFE. And that's the new term for the Evaluation Team Report, or what used to be called the ETR. So for every 3 years, a student has an evaluation or reevaluation to determine their eligibility for special education services. This is a great way also to get a complete picture of your student's educational performance. So during the planning meeting, the educational team, which also includes parent input, will determine what information is already available and what information related to the student's disability is needed further. So this might include additional areas of concern that maybe the parents bring up, or maybe additional staff have noticed changes in the child. Maybe there's been visual needs that need to be addressed. Maybe PT or OT concerns that are on the table, or additional language testing that might be requested. This also includes outside therapy reports that might be helpful for the team if the child is receiving outside OT or PT services, or additional speech and language services that might bring to the table information that could be really helpful for the team. So you want to look at all of that in making your decisions and moving forward. So a team approach is definitely necessary. Determination of eligibility or continuation of education is a team decision. It cannot be made by one individual. So now that we've discussed why we test and the benefits, let's look at who can perform the determined assessments or evaluations. So who does that? So we want a professional who has the credentials to administer the formal tests used in the assessment. You want someone familiar with the tool that you're going to be giving. A professional who is familiar with the effects of hearing loss on tests and classroom performance. You want somebody who's knowledgeable about deaf and hard of hearing. You want a professional who has experience with interaction as a teacher, an intervention as a teacher, a speech-language pathologist, psychologist, or counselor for children who are deaf and hard of hearing. You also want a professional who's able to communicate effectively with the student, the parents, and the teachers during and after the assessment, with or without an interpreter. And this is really critical. I know in our program, we are a total communication program, and this is really important. So when I'm giving an assessment to a student and it's a deaf child that uses primarily ASL as communication mode, I will often bring in my interpreter, my certified interpreter, to help me with the assessment. I want to really respect that child's language and gather as much information as possible when collecting information and assessing them. So this also is twofold too. So when we're presenting information at an IEP or a evaluation team meeting, we want to also respect the language of the parents as well. So in our program, we have several families that the parents speak Spanish as their native language. So we would bring in a Spanish interpreter so that the information can then be shared with the parents in their native language. So some meetings can be quite interesting with a Spanish interpreter as well as a sign language interpreter, which is all beautiful to see everyone's language being represented and shared. So let's talk about planning for testing. So examiner must have information about the student to help guide testing and really assess what kind of assessment or evaluation is going to be necessary. So that might be, as helpful information that might be needed would be age of diagnosis. When was the child first diagnosed or identified with a hearing impairment? Degree of hearing loss is an important factor as well. Etiology, age of amplification, and use of amplification. Have they been consistent users of amplification along the way? History of amplification, so that goes hand in hand. Education history. Have they been in school since early intervention classes, or have they joined at the kindergarten level? Language history. Are they using language at home? Are the parents interacting with the student? Primary mode of communication. How are they first expressing themselves? and what mode of communication are they using. Any physical disabilities that might be present would be important to know, as well as visual impairments to prepare for testing, cultural differences and expectations. This is important too if you have a family that might have cultural responses that for testing purposes are needed. Cognitive impairments that might be present, or learning disorders that might also impact testing. So planning and collaborating with the other professionals is really imperative. Depending on the student's needs, and if there are additional disabilities present, such as visual impairments or physical impairments, collaboration with professionals from other discipline areas is very critical. So for example, we have some deaf-blind students in our program as well, and I work very closely with our visual consultant from the county when I assess, so that she often will share with me assessments that are geared for or designed for the visually impaired population that have been adapted and modified. So it's really important. You might need to change print material for the assessment and presentation. And lighting is important, very critical. So you want to work with also your OTs or PTs if you have a student as far as responding. Do they have left or right side paralysis? That might be something too that you need to consider when you are assessing. So testing considerations that we all really want to keep in mind is use a certified interpreter if necessary to honor the student's primary mode of communication. And we touched on that before. It's really critical to respect the mode of the communication the student is using. And check equipment functioning prior to testing, have backup batteries available, and use a Roger personal amplification system during testing sessions. And this has happened to me personally, that you want to really make sure you check the students' hearing aids if they use hearing aids, and have backup batteries, because you don't want to be in the middle of a test and have their batteries fail on you. You want to eliminate background noise whenever possible, decrease distractions within the testing environment to really give them the most focus that they can have, and seating for the student to allow for maximum speech reading and auditory access. That's really critical as well. So there's testing challenges giving this population as well, things just to kind of keep in mind. Examiners may not have the credentials or experience to work with a deaf and hard of hearing population. So you want to make sure that you have professionals that are knowledgeable in the field. Examiners are unable to communicate with their student. A child with deaf and hard of hearing may use one of several different communication languages or modalities. Like I said before, it might be ASL, it might be oral and sign together, it might be auditory oral. So you want to make sure they have someone that can really communicate best with those. The results of tests are normed or compared to children who are hearing should be interpreted with caution. And we've talked about that to really make sure that that's documented in reports, as well as on the professional's end, because you are modifying the test in some way. And evaluation teams and IEP teams sometimes don't include professionals trained in the education of deaf and hard of hearing students. And if outside consultants are involved, they may not be familiar with the student being assessed. Now, child's performance on one isolated task will rarely be comparable to that child's performance in a classroom during a familiar activity. So again, you're taking just a snapshot of that student in a testing environment. So you want to really make sure that you can kind of gather those formal and informal assessments as well to really look at the child's overall performance. So standardized practices are designed to ensure that the student's scores can be compared to the scores of the individual within the test norming sample. So unfortunately, like we've stated, it's a lack of assessments designed and normed on the deaf and hard of hearing population. So we're really left with using tests that are normed on typical hearing children. So as a result, when using an evaluation tool like that format, some form of modification is made, and standardized practices are really not maintained. So it's imperative that the evaluator make note of this in the student's report. So there are some areas of assessments that might be included: expressive receptive language skills, auditory listening, speech skills, vocabulary, both expressive and receptive, basic concepts, assessment of sign language, cognitive and intellectual skills, psychosocial, behavioral, occupational therapy, physical therapy, and visual acuity. Here is a really great resource for you. It lists all the assessments that are available, both hearing assessments as well as DHH assessments that can be used with our population. It's a great resource. And here I listed just some specific assessments that our program typically uses that are really either have norms for deaf and hard of hearing or really gather a lot of great information specifically for this population. And there are some additional websites and resources as well. Okay, we are down to the wire and made it through. Do we have any questions out there lingering? I know that was a lot of information.
If you give me 1 second, I will go ahead and unmute everybody.
Okay.
So feel free if anybody has any questions to go ahead and ask.
Thank you.
Hi, Tabby. Can you hear me? This is Janelle.
Hi, Janelle. Yes, we can hear you.
Hi. I have a question that maybe everyone out there would like to know is how can they get the resources that Chris had just listed up there regarding some of those tests and the websites? Are there a way that they can go back in the slides or find these slides?
There's one slide I did add towards the very end. It's listing the test names for just DHH specific assessments. And then there's the link before that, which will give you the additional test names too that are often used. And they're mostly the hearing assessments that are kind of adjusted and modified with our population. But the tests are listed there. I don't know if I have anything. I can maybe put together something as far as manufacturers or developers of the tests. That way, with websites, they can find those specific tests. I can get that.
Janelle, this is Tabby. I think also I can go ahead and type those up and include those in an email that I send out with a link to the survey at the end. How does that sound?
That's wonderful. And I do have one other question for you, Chris, because this is something that comes up quite a bit, is functioning listening tests. Can you talk a little bit about that and the importance of those specific tests for our students?
Yes, and I didn't. I believe that resource is on the assessment, the full assessment resource list. But that is another great tool, and it's a checklist that can be used with the student or without the student to really get them thinking about. It's really geared for older, I would say, middle school to older students, to really get them thinking about how they're using their hearing and how the environment impacts their listening. And that would make them really start thinking about self-advocacy, maybe possibly written, some goals about self-advocacy could be written into the IEP as a result of those assessments. And it's great. Gather a lot of information. Both could look at different environments, so a classroom environment versus a quiet environment, to really help. And it's a good tool to use to guide IEP goals as well.
Thank you.
Mm-hmm.
Does anybody have any other questions for Chris? Well, Chris, I just want to thank you again for taking the time to present today. We really appreciate it. This is a lot of great information, so thank you very much.
You're welcome.
For everybody who is participating, we will take this recording and post it on YouTube so you can view that. And I will also send an email out with the list of assessments and information for you, along with a survey we would ask you to complete just to let us know how the Lunch and Learn was and what you might want to see in the future. So thank you all so much for joining us today, and we hope to see you next month.
Thank you.
Thank you.
Thank you.
Bye.